Welcome to the lecture on the lumbosacral plexus. During development, the flexor muscles and their innervation of the lower extremity are located on the ventral aspect of the embryo. As the embryo develops, the lower extremity undergoes 180 degrees of internal rotation. This places the flexors and their innervation on the posterior side and the extensors and their innervation on the anterior side of the adult. Therefore, the anterior division nerves innervate structures on the posterior thigh, leg, and plantar aspect of the foot, while the posterior division nerves innervate structures on the anterior thigh, leg, and dorsum of the foot. The lumbosacral plexus consists of the ventral rami from L2 through S4. Some sources also include L1. The lumbosacral plexus consists of voluntary motor, somatosensory, and postganglionic sympathetic axons. They are arranged into anterior and posterior division nerves. There are 8 major nerves of the lumbosacral plexus, 4 anterior division nerves and 4 posterior division nerves. It may be easiest to think of these as being paired based on their spinal segment contribution. The lumbosacral trunk contains anterior and posterior division nerves of the ventral rami of L4 through L5. The lumbosacral trunk is the connection between the lumbar plexus and the sacral plexus. It contributes axons to 3 of the 4 pairs of major nerves. The lumbar portion of the lumbosacral plexus is sandwiched between the quadratus lumborum and psoas major muscles. The sacral portion of the lumbosacral plexus lies anterior to the piriformis muscle. The next 2 slides list the 8 major nerves of the lumbosacral plexus, their division, and then also the spinal nerve segment that contributes to each of the nerves. The obturator nerve is the anterior division nerve with L2 through L4 contribution. The femoral nerve is a posterior division nerve with L2, L4 contribution. So as mentioned earlier, we can think of the obturator nerve and the femoral nerve as one of the pairs. The nerve to quadratus femoris is an anterior division nerve with contribution from L4 through S1. The superior gluteal nerve is a posterior division nerve with contribution from L4 through L1. The nerve to obturator internus is an anterior division nerve with contribution from L5 through S2, whereas the inferior gluteal nerve is a posterior division nerve with contribution from L5 through S2. The tibial nerve is an anterior division nerve with contribution from L4 through S3. The common fibular nerve is a posterior division nerve with contribution from L4 through S2. 87.5% of the time, the common fibular nerve arises inferior to the piriformis and is encased within a fascial connective tissue along with the tibial nerve. When the tibial nerve and the common fibular nerve are encased within this fascial tissue, they together make up what is called the sciatic nerve. 12% of the time, the common fibular nerve pierces through the piriformis. 0.5% of the time, the common fibular nerve arises superior to the piriformis. Before we move on to name the 8 smaller branches of the lumbosacral plexus, I want to review the 4 pairs of the major nerves of the lumbosacral plexus. These pairs include the obturator nerve and femoral nerve, the nerve quadratus femoral and the superior gluteal nerve, the nerve obturator internus, and the inferior gluteal nerve, and the tibial nerve and the common fibular nerve. The 8 smaller branches of the lumbosacral plexus are as follows: the ilioinguinal and iliohypogastric nerves, with contribution from L1, the genitofemoral nerve, with contribution from L1 through L2, the lateral femoral cutaneous nerve, with contribution from L2 through L3. Note this is a posterior division nerve. The nerve to psoas major, also a posterior division nerve, with contribution from L2 through L3. Nerve to piriformis is a posterior division nerve with contribution from S1 through S2. The posterior femoral cutaneous nerve has mixed innervation from anterior and posterior divisions of S1 through S3, and the pudendal nerve is an anterior division nerve with contribution from S2 through S4. The lateral femoral cutaneous nerve, the femoral nerve, the femoral artery and vein, as well as the iliopsoas muscle, pass from the pelvic region into the anterior thigh region. They course through various tunnels or compartments. Note that the iliopsoas is a term that is used to group together the psoas major muscle and the iliacus muscle. The lateral femoral cutaneous nerve passes through a tunnel between the iliopsoas muscle and the anterior superior iliac spine. At times, this nerve may become entrapped, causing pain in the lateral femoral cutaneous nerve region. The femoral nerve passes through the same compartment as the iliopsoas muscle, and this is called the lacuna. The femoral artery and the femoral vein pass through a separate vascular compartment. The coccygeal plexus is the nerve contributions from S4 through the coccygeal nerve. The coccygeal plexus contains anterior division nerves and includes the nerve to levator ani, S3 through S5, and the nerve to coccygeus, S3 through S4, with inconsistent contribution from S5. Use the slide to study and draw the lumbosacral plexus.